How patient advocacy changed cervical dysplasia policy. Imagine a community coming together to make a real difference in health care. That's exactly what patient advocacy has done for cervical dysplasia, a condition that can lead to cervical cancer if not caught early. Advocacy groups, often led by women who have experienced or are at risk of cervical health issues, have worked tirelessly to raise awareness and push for better policies. Their efforts have helped change how we approach screening, diagnosis, and treatment. Cervical dysplasia involves abnormal cell changes on the surface of the cervix. These changes are usually detected through Pap smears and HPV testing. Catching these early changes is vital because it allows for treatment before they develop into cancer. Patient advocates have emphasized the importance of regular screening and follow-up care, especially in underserved communities where access might be limited. Their work has increased screening rates, leading to earlier detection and better outcomes. One major way advocacy has influenced policy is through the development of clinical guidelines. In the past, management of abnormal cervical cells was often one-size-fits-all. Now, thanks to advocacy efforts, guidelines recommend personalized, risk-based management. This means that decisions about follow-up and treatment are tailored to each woman's specific situation, considering her screening history and test results. This approach reduces unnecessary procedures and focuses resources on those who need them most. Advocates have also played a key role in expanding access to screening programs. Initiatives like the National Breast and Cervical Early Detection Program in the United States provide free or low-cost screening for women who might not otherwise afford it. Policies like the Affordable Care Act have made preventive services, including cervical cancer screening, more accessible by removing cost barriers. These changes have helped many women get screened and receive timely care. Listening to women's experiences has been another important part of advocacy. Advocates highlight barriers such as cultural stigma, misinformation, and difficulty accessing health care. By voicing these concerns, they have encouraged health systems to become more responsive and culturally sensitive. This patient-centered approach helps ensure that all women, regardless of background, can participate in screening and follow-up care. In summary, patient advocacy has transformed cervical dysplasia policy by raising awareness, shaping personalized guidelines, expanding access to screening, and making healthcare more responsive to diverse needs. These efforts have led to earlier detection, better management, and ultimately a reduction in cervical cancer cases. From the perspective of reproductive health, this shows how empowered individuals and communities can work together with healthcare providers and policymakers to improve cancer prevention and care for everyone. Always remember to consult healthcare professionals for personalized advice and screening recommendations.